The Democratic Alliance claims that the Gauteng Health Department owes 3.1 billion rand to over 42,000 suppliers who haven't been paid within the legally required 30-day period. The party says this was disclosed during a meeting last week at the Gauteng Legislature's Finance Committees. Of course, it comes as we have seen several hospitals struggling with issues of staff and food shortages. The DA's Jack Bloom joins us now. Good evening, Jack. Thank you so much for your time. It is an appalling situation to find ourselves in, where the department owes service providers 3.1 billion rand. What was the reason given for why things had been allowed to escalate to this point?
Well, it's actually a long-standing problem, but in fact, at one stage they had improved the payment rate, and then it seemed to get dramatically worse. At the end of last year, the figure we were given that only 22% of companies were paid within the required 30 days. Now, you can imagine if you're a small company, this is a lifeline for you. You need to be paid timely because you need to pay your staff. You've got other people that you have to pay, and some of these small businesses go out of business. 42,000 is an enormous number, and 3 billion rand has also been allowed to grow over the years because some of these payments date back months and years. And that's why you get certain companies not providing services because they're not being paid. And the other problem just seems to be poor contract management, because what's happened with the bread contracts, from what I can gather at various hospitals, not just Chris Hani Baragwanath Hospital, is that the old contract runs out and then for some reason they can't renew it or extend it. Now, you have to ask yourself, why is it that hospitals run out of basic commodity like bread? And I did some further research, and I found that there's a number of hospitals across the province which run out of, other foodstuffs, chicken, meat, essential protein, fish, vegetables. At the Sharpenkerk Johannesburg Hospital, what patients are currently being fed is quite disgusting, actually. I don't know if they're trying to save money or they can't get better because they've got the wrong suppliers, but something needs to change drastically so that our patients get proper meals at the hospitals.
Jack, from what you've been able to ascertain, is there a direct link between the non-payment of service providers that you're referencing and the challenges that we are seeing when it comes to the provision of some services to hospitals? You've raised the issue of food. There's another one around waste collection that has also come up. I mean, do we even know how extensive then this runs?
Well, as we do know that the medical waste companies refusing to take the medical waste away from Chris Hani Baragwanath Hospital, in fact, other hospitals as well. And I hear every day of services that are being terminated because companies aren't being paid. Look, part of the problem is that as we come to the end of the financial year, which is the end of March, they call it the dry season. Suddenly they can't make payments for some reason. It happens every year. But look, this is a department in crisis. There's an acting chief financial officer. There's an acting head of department. There's no excuse for that. You need honest, competent leadership. Put the right people in the right jobs, and that's not what's happened at the Gauteng Health Department. I think the rot there is very, very deep. Obviously, there's massive corruption, as we've seen with the PPE contracts and elsewhere. My estimate is that over the last 2 years, about 2 billion rand has been squandered, wasted, stolen one way or another. And things are so bad there that an honest, competent official, Babita Deokaran, was assassinated last year. Who knows what she was uncovering in that department? So I do hold the Premier of this province accountable, David Makura, because 8 years ago when he was inaugurated, he said that he would seek a, quote, urgent turnaround. Now, urgent turnaround after 8 years. He has appointed the wrong people. It's his prerogative to appoint heads of departments and MECs, and he hasn't made the right appointments, and he really hasn't fixed up that department. It's unfortunately across the board. We see it with the failure to reopen the Sharpmaker Johannesburg Hospital, which is really causing immense suffering to patients. I think that more patients' lives are being lost by that than happened with the Life Esidimeni tragedy.
The DA's health spokesperson, Jack Bloom, thanks for your time tonight.